Okay, onto a different story now. On Monday, different stakeholders met online within the African Union-led Continental Trusted Travel Initiative to iron out details of the project, which aims to protect travelers and mitigate duplication of COVID-19 tests on the continent. The partners include the Africa Center for Disease Control, Panabios and Econet and African Airlines. We're joined now online by Dr. Justin Maeda. He's the head of surveillance and disease intelligence at the Africa Center for Disease Control. A very good morning and welcome to you. Also joined by Matthiew Gogeu. He is the chief operations officer at Lancet. And we're also joined by Robie Buck, the chairperson at Ampath. A very good morning to all of you, and thank you so much for joining us. Dr. Maeda, let's perhaps start with you. Now, this project is meant to continue the African Union conversation of saving lives, economies, and livelihoods in Africa. What is the Trusted Travel Initiative? Dr. Maeda, are you able to hear us? Dr. Maeda, are you able to hear us?
Yes, I can hear you now. I think
awesome. I was just saying to you, are you still there? I was just saying to you that this project is meant to continue the conversation that has already been started within the African Union about saving lives and economies and livelihoods on the continent. Can you just tell us what the Trusted Travel Initiative is all about?
Hello?
All right, we seem to be having a problem with Dr. Maeda. We will keep trying to make an effort.
Can you hear me now?
Yes, we can hear you perfectly.
Sure. So thank you, and thank you for that introduction. Yes, this is part of the bigger conversation we had as started at Africa Union to help the whole African continent to start saving economies and livelihood, while we're also trying to save the lives. And we have to strike a balance between the economy and the livelihoods and also the saving lives itself. And as part of the Africa CDC, through the wider angle of stakeholders engagement, including the private sectors, has engaged to launch this trusted travel portal. The key here is to make sure that we support the whole efforts in ensuring we have access to information, and both sectors, the public health authorities, the COVID-19 lab test providers, the airline.
Okay, we seem to have lost that line again, but let's now talk to the other participants in the conversation. And both of you are from similar stakeholders where you handle a very important cog in this conversation, the testing part. South Africa just opened up its borders on the 1st of October, and one of the very contentious conversations has been about the testing protocols, making sure that people who come through have positive or have clear results that were carried out 72 hours before traveling to South Africa. Perhaps let's start with you, Mr. Robie Buck, the chairperson for Ampath. What are you putting in place to ensure the efficacy of your testing systems, ensuring that travelers, when they come through, there's credibility in their testing results?
At the moment, the main testing requirements are, as you said, 72 hours prior to departure. So as a lab that's based primarily in Southern Africa and focused on South Africa, we'll be providing tests for people leaving South Africa, which they require within 72 hours. Now, there's from the discussions on Monday, it's apparent that not only the PCR test will be acceptable to African countries, but the rapid antigen test will also become acceptable to most countries in Africa. So that's the sort of test, because its turnaround time is about 30 minutes, may be able to be provided at airports by passengers that haven't manage to get their results within 72 hours or get to a laboratory. But the ideal is for passengers crossing the border or leaving via airports or ports or land borders to get a test from an accredited laboratory like Ampath and Lancet prior to within 72 hours prior to departure.
Mr. Gogeu, have you previously have had to work with your other counterparts in the testing space on such big projects?
Yes, the last 6 months we have worked with all governments across Africa because we have installed more than 10 high-throughput real-time PCR solutions for COVID-19 with the same quality level everywhere, using the best techniques on the market to guarantee a 48-hour turnaround time to every passengers, but also every sick people. So it's really good to be part of this initiative because the missing part was to have trust around results. And because there is so many stakeholders around this project, with the airline company, with the immigrations, with the labs. So it's good to have a trusted platform to exchange and to publish our results and give information in a secure way.
And of course, one of the biggest aims of this project is to ensure that travelers are confident about traveling again. Just take us through, and let's start with you, Dr. Maeda. I don't know if we have you back. What sort of activities are going to be put in place to ensure that Africans who start traveling and also international travelers who start traveling to the continent feel safe about traveling? Okay, we're once again having a problem with Dr. Maeda, and we're just going to go back to Mr. Buck. Mr. Buck, you cover a good bulk of the SADC countries. What happens when travel is with countries that are not within the SADC space, the other 4 regions of the continent?
I think this trusted travel initiative is very important to try and harmonize the travel arrangements. Now, that trusted travel portal produced by Panabios is very helpful in this regard, especially while different African countries have different requirements. Because on the app you can actually look up exactly what the requirements of the country of your destination and adhere to those. We expect that all countries ultimately will accept PCRs within 72 hours or antigen tests at the airport. But the details will be available on the app, and the public are encouraged to upload the Panabios app prior to travel, and then they can avail themselves of an accredited laboratory like Ampath prior to traveling. I say 72 hours. They've got plenty of time to get their PCR test done, and they will get a certificate via the app, a formal certificate from the lab, which will be accepted by all the African countries that buy into this initiative, which we expect everyone to be buying, especially given the response that we saw on Monday.
Yeah.
And then there should be no problems on arrival.
Mr. Gogeu, most countries opened up their borders on the 1st of September. South Africa opened on the 1st of October. What sort of glitches have you encountered already?
With our lab in Nigeria and Ghana, in Kenya, Uganda, Rwanda, Zimbabwe, Swaziland, and Mozambique, we have a lot of requests for passengers and from airlines to do testing with a good turnaround time. And we have already worked a lot with these companies, with the biggest. But it's good to have a unique platform with this African Union and African CDC, because now we have requested from the different airlines company, from the different governments, and it's not always consistent. So it's really good to have a unique platform and a trusted one.
Mr. Maeda, I'm going to try you once again. Just indicate if you're back with us in the conversation.
Yes, I'm back.
Fantastic.
There's been a challenge with network here, but I'm back.
It's clearly going to be a challenge to harmonize the 5 African regions. What is being done in this case? South Africa has that requirement for testing 72 hours before travel. I imagine different countries have different requirements. How are you harmonizing all of these?
Sure. So this is why this platform is here to serve also as a harmonization platform, as well as information exchange and access to all countries. So and this will require a lot of engagement with different member states as we move on toward the implementation. We acknowledge that it's not going to be easy, but we'll still be trying to make sure that we bring most of the countries into a table of conversation and trying to harmonize the widespread of diversity in the testing and other pre-entry and exit requirement.
Yeah.
So it's a dialogue, it's an ongoing process, and it will take time, but we're here to do it.
Just take us through the technologies that you're using.
So the technology that is being used, it's a combination of different functions that are being given and also supported by a wide range of partnership. First of all, to ensure that we also have a security of information that is transferred between one place to another, as well as ensuring that all the information that is required is needed. So within the platform, we have like 3 main functions for now. Function number 1 is a registry of all the pre-entry and exit requirements from different countries, from all 55 member states. And we are also giving it to countries to be able to offer some entry and exit requirements. The second part is also on the testing, trusted testing, whereby different labs can be connected, as well as all the infrastructures on lab being connected to the platform for those who are traveling to be able to access and know which are those requirements that are required for my country of destination. And the third part now is on the health status report, whereby travelers or anyone else who is a user of the platform can keep on tracking his own history on health status in terms of the tests that have been conducted previously, his own self-evaluation, etc., to be able to have all those health records over time. And within that also it can be linked with other facilities that are also provided in this platform.
Of course, this is a very important conversation, but because we're a live show and we have time constraints, we're going to have to end it here. But before we go, let me just talk quickly to you, Mr. Gogeu and Mr. Buck. You can start first, Mr. Gogeu. This has been a very, what everybody calls uncharted territory, especially for the testing space, the past few months since lockdowns all over the world. What have you learned, Mr. Gogeu, about how you can improve your work?
It has been a big challenge to work with all stakeholders, to register the reagents in country, to do the evaluation, to do all the quality process, to have the same level of quality across Africa in all countries, because we have exactly the same level of quality everywhere. And it's a big challenge because the teamwork to synchronize everywhere and to launch a platform in 13 countries at the same time was a big challenge. So I think we are now well prepared if there is other challenges of the same nature to be ready to set up new platform across Africa.
Mr. Buck, your learning spaces in the past few months?
I think the biggest challenge in our learning is that it's the time to get a result back to the patient and to the doctor as fast as possible, and certainly within 24 hours. Is an absolute imperative, because it's travel requirements, pre-op, pre-admissions to hospital, all sorts of applications. And so we've increased our capacity to make sure that we don't go longer than 24 hours and at the most 48 hours, because during the peak of the epidemic in July, I think all the laboratories suffered a little bit because of overload. And I think the most important learning was to have sufficient capacity across the country and in Southern Africa in general, to actually make sure that we never allow that turnaround time to exceed 24 hours.
We didn't even touch the surface about what this project hopes to achieve, but we hope to continue the conversation. Let me thank you very much for talking to us this morning. Dr. Justin Maeda is the head for surveillance and disease intelligence at the Africa CDC, and Matthiew Gogeu is the COO at Lancet, and Robie Buck is the chairperson at Ampath. Let's take you live.